Hello everyone, welcome to Internal Medicine Theory. My name is Ali and today we will talk about internal medicine. Today's topic will be general examination. So, first thing we should know that examination divided to three types: general, regional, and systemic. In general, which is today's topic, we will talk about mentality and appearance, vital signs, complexion, and physical size or build. Next videos we will talk about regional, which is include face, head, neck and veins, upper limb and clumping fingers, lower limbs, upper limb and clumping fingers, lower limb and nail examination. In systemic, we will talk about musculoskeleton, gastrourinary tract, gastrointestinal tract, cardiovascular, respiratory, etc., etc. Okay, so first of all, let's talk about mentality and appearance, which is the first thing each doctor should assess in every patient. Here's some common terminology that each one of us should understand. Alert mean awake or easily aroused, as you can see in this picture. Confusion, that's mean disorientation, forgot stuff. For example, here in this picture. Next, we have a lethargic, which is not fully alert, drifts off when not stimulated. For example, here. Obtunded, which is sleeps most times, difficult to arouse. We could arouse him, but it's so difficult. It's aroused only by loud noises, vigorous shaking or pain. Next is this one is obtunded. Next is the stopper. Need persistent loud noise or pain for arousal to make him respond to stimuli. Next, which is coma, there is 100% no response to any external stimuli. How can we assess the level of consciousness in each patient? We can assist them by Glasgow Coma Scale, which has 3 aspects: eye opening, motor and best verbal. Okay, there is 3 level of severity. We have mild, which is from 13 to 15, moderate, which is from 9 to 12, or we have severe from 3 to 8. Normal level, it should be 15. Next we talk about the appearance or the condition of the patient, which is very easy to notice if the patient's healthy, ill, toxic, hectic, irritable, depressed. It's very important to notice. Okay, next thing to talk about is the vital signs. The first vital signs should be obtained is the pulse. The pulse means the pressure of blood that pushing against the wall of the artery as the heart contracts and relax. Okay, there is specific evaluation points for the pulse assessment. First of all, the rate. The rate should be from between 60 and 100 beats per minute. If it's more than that, it's called tachycardia. If it's less than that, it's called bradycardia. Next is the rhythm. Rhythm should be regular. Okay, if it's irregular, that means abnormal rhythm. Irregularity types. First of all, we have irregular irregularity and we have regular irregularity. There is common diseases for irregular irregularity, for example, atrial fibrillation, premature atrial contraction or premature ventricular contraction. Heart blocks also common with irregular irregularity pulse. Next, the regular irregularity, for example, in pulsus bigemini or pulsus trigemini. Next evaluation point is the volume. The volume always should be normal. You should feel normal volume and differentiate it between moderate obstruction or severe obstruction, where semi-diminished volume of the pulse. Fourth thing is the equality. The equality of the pulse should be the same on both sides, same volume and same character. Fifth evaluation points, it's the special character. We have 6 special characters. The first one, which is the bounding pulse. In the bounding pulse, we can see high ascending and high descending with high amplitude. Common diseases that come with bounding pulse are patent ductus arteriosus, which is conjunctival cardiac abnormalities, atherosclerosis of the aorta, bradycardia, and in hyperkinetic state. Next, let's talk about platea pulse, which is slow ascending and slow descending with relatively low volume. Okay? Common disease that had this type of pulse are aortic stenosis, beta blocker therapy, and left ventricular failure. Next, let's talk about pulsus paradoxicus, which is fluctuation between inspiration and expiration by rate of 10 millimeter of mercury. Okay, as you can see in this picture, in inspiration it's less than expiration. Okay, this type of pulse could be seen in pericardial tamponade or effusion, which is accumulation of fluid in the pericardium. It could be also seen in congestive heart failures or in COPD, mostly in asthma. Next, let's talk about pulsus biferinus. It's mean the pulse has two phases, okay? 1, 2. It could be palpated. This specific biferinus pulse could be seen in aortic regurgitation that are combined by aortic stenosis or isolated aortic regurgitation. It could also be seen in hypertrophic obstructive cardiomyopathy. Next, we have the altered pulse, okay, or pulsus alternans, which we have low, high, low, high, low, high, etc. by the aspect of the volume. We can see this type in severe left ventricular failure. Next special pulse is bigemini, trigemini, and quadrogeminus. What does that mean? It's a special type of double, tripled, or more than that. Okay, so we have double, we have pause, we have triple, we have pause 2. This specific character could be seen in premature ventricular contraction, digoxin toxicity, myocarditis, and in myocardial infarction. These are the sites of pulse taking. We have dorsalis pedis, anterior tibial, posterior tibial, superficial temporal, axillary, brachial, popliteal, and the femoral artery pulse. Okay, so what this procedure called? Feel free to pause the video to think about it. So this procedure called the radiofemoral delay assessments. We assess the delay between the radial artery pulse and the femoral artery pulse, and it should be very or undetectable delay. Okay, if we can detect any delay, that may lead us to suspect that this patient may have coarctation of aorta, because obviously if there is a coarctation in the aorta, there might be delay. Here you have 3 examples of pulse description. The first one is normal. We have female patient pulse is regular, 75, average volume, equal on both sides, no special character. Everything is normal with vascular wall, intact peripheral pulsation, and there is no any radiofemoral delay. This is how you should write the description of the pulse. Next, this is an example of aortic regurgitation pulse. Male, for example, 45-year-old, patient pulse is regular, 75 beats per minute with relatively big volume, equal on both sides, and the water hammer pulse. There is no other any pathology or no any abnormalities related to the pulse. Next example is for patients with atrial fibrillation, female, 56-year-old, patient pulse is irregular. It's irregular, okay? 96 beats per minute, which is normal but a little bit high. Variable volume, equal on both sides with pulse deficits, okay, by 10 beats per minute, with intact peripheral and no radiofemoral delay. Next thing to talk about is the temperature. This is the next important vital signs. As all of you know, the normal temperature is 36 to 37 Celsius. We have more than that, which is called fever. Fever is subdivided to subfebrile, febrile, pyrotic, and hyperpyrotic. Hypo, it's subnormal, still normal, but it's a little bit low. And less than that, less than 35 Celsius, considered hypothermia. The types of temperature, we have 4 types of temperature: continuous or sustained, which could be seen in gram-negative. Sepsis, central nervous system damage. The character of this type of temperature, there is fluctuation less than 1 and more than the baseline in daily temperature charts. Next type, we have the remittent. The remittent, there is a fluctuations more than 1 Celsius and more than the baseline. This type could be seen in viral infections or in tuberculosis. Third one, which is the hectic or the intermittence, there's a fluctuations more than 1 Celsius and may reach the baseline within hours. Okay, so there is an increase, but it may reach the normal line. Could be seen in abscess, in malaria infections. Next, we have the relapsing, the cyclic. There is periods of normal and periods of fever. This type could be seen in lymphomas, in bronchiolitis, etc. As you can see here, we have the sites of temperature obtained: rectal, oral, or axillary. Next vital signs to be obtained is the blood pressure. The blood pressure is the pressure of the blood in the circulatory system that generated by the pressure on the vessel's walls. We have the systolic and the diastolic. The systolic, it's due to the contraction of the ventricles. The diastolic, it's obviously due to the relaxations of the ventricles. Blood pressure is regulated by central nervous system in the vasomotor center, medulla oblongata. It's also regulated by hormones, for example, vasopressin, adrenaline, noradrenaline, by renal system, renin, angiotensin, aldosterone system, and also it's regulated locally. So blood pressure management, we have devices and we have also evaluation points. The less accurate device is the electronic. You need nothing exactly to do, just place the cuff 2 to 3 centimeter above the antecubital fossa and press start, and you will have readings on the screen. The aneroid, it's a device that comes with good accuracy. We need to place the cuff 2 to 3 centimeter above the antecubital fossa and the bell of the stethoscope under the cuff on the brachial artery area. We can see the aneroid device here. Third one, which is the mercury blood pressure device. It is very accurate. The steps are the same of aneroid. Evaluation points. First of all, we have one-sided, which is for the majority of the patients that's expected to have blood pressure. Right and left side assessments in patient that's suspected to have stenosis, for example, in brachial stenosis. Next is the upper limb and lower limb in patient that's suspected to have abdominal aortic stenosis or femoral stenosis. Lying flat and on standing to detect the orthostatic hypotension if it's present. Okay, so how can we use the blood pressure device? As it's shown here, we just place the cuff 2 to 3 centimeters above the antecubital fossa, place the bell on the brachial artery and squeeze the pulp that will inflate the cuff with the air until it reach 180 or 200. Then release the valve which is on the pulp. The first sound that you're gonna hear, it is systolic, and the last sound that you're gonna hear, it is the diastolic. So the first one is sys, the last one is dis. Okay, and by that you will obtain the blood pressure. Next vital signs to be obtained is the respiratory rate. Normal respiratory rate from 12 to 20. More than that are tachypnoea, less than that are bradypnoea. So how can we measure it? Just pretend that you repeating the measurement of the pulse and look at the chest and start counting. Okay, so why we shouldn't tell the patients that we will measure the respiratory rate? Because that may cause some elevation in the respiratory rates, which is uncontrollably. Next thing, after the vital signs, is the complexion. In the complexion, we have 3 main color change of the body. We have the pallor, jaundice, and cyanosis. In pallor, it's the deficiency of the color or decrease the visibility of oxyhemoglobin. There are 2 causes. There's anemic and non-anemic. Anemic is obviously due to, for example, decrease in erythrocyte, decrease in hemoglobin, etc. Non-anemic, we have shock, toxemia, for example, in infective endocarditis, edema of the face, in nephrotic syndrome, racial pallor, albinism, myxedema, and lymphedema also may be present with pallor. Next thing is jaundice. Jaundice, it's yellow discoloration of the skin and the mucus due to increased level of bilirubin. There are three types. We have the hepatocellular, the hemolytic, and the obstruction. The hepatocellular, orange, yellow, like it might be present in viral hepatitis and in cirrhosis. The second one, which is the hemolytic type, it's look like a lemon yellow. Third type is the obstructive type or the post-hepatic olive green. Next, color change to detect its cyanosis. Cyanosis, it's a bluish discoloration of the skin and mucous membrane. There's two types. There's the central cyanosis and there is the peripheral cyanosis. Central cyanosis could be seen in COPD, pneumothorax, pulmonary embolism, etc., etc. Peripheral cyanosis, it could be seen in polystemia, it could be seen in cold temperature change, in shock, in Ryan's phenomena, etc. These are three examples. We have the first one, which is pallor, as you can see, change in eye color, in the tongue and in the hand. Also the second example in jaundice. The third one is in cyanosis. You can see this one is central and this one is peripheral. Last thing to evaluate is the physique or the build. Two things to look for, the height and the weight. The height, if look for dwarfism or tall patients. Dwarfism, ask if it's familial or if there is any other endocrinological abnormalities, for example, decrease in growth hormone releasing hormone or decrease in growth hormone secretion. On the other hand, for the tall patients, you should assess and look after for other symptoms and signs that are related to Marfan syndromes or to any other endocrinological disorder, for example, in acromegaly. You can see here we have three examples. The first one, which is sthenic, thin, and a little bit tall. The middle one, it's hypersthenic or muscular. The third one, it's short and obese. Next evaluation point is the weight by assessment of BMI, and BMI is body mass index by dividing the weight by the height. Normal is from 18 to 24.9. Less than that, considered underweight. More than that, considered overweight or obesity. Obesity, we have two classes, class 1, which is from 30 to 35, or class 2 from 35 to 40. And as you can see here, there's the look of the underweighted woman, normal BMI, overweighted, obese type 1, extremely obesity or type 2. Thank you very much for watching. See you next time.